Hi everyone, pretty good Sunday. As you can see, I'm still basking in the glory of last night. The Richmond Tigers won quite decisively near the end with their clash with Geelong at the Gabba. Only 30,000 people there, but there were quite a few Tiger supporters that were celebrating into the game, so that was quite gratifying to see. So somehow these Richmond supporters had got to Queensland. Yeah, it was a very entertaining game, and Dustin Martin proved his worth yet again. Amazing player, and a bit sad to see Gary Ablett Jr. go. He's been an exciting player to watch, and Geelong put up a pretty good fight. It was a good match, so yeah, all round it worked very well. And there was a forecast it was going to be torrential rain, but luckily that dumped on the Gabba in the afternoon prior to the match, and the drainage is so good that there wasn't a problem. So yeah, it was a very good spectacle. A lot of PC crap at the beginning with entertainment, but I just skipped over that and waited till the main game. So yeah, it was good. So congrats to Richmond for winning another premiership, and this time I got to see it rather than when I was in Spain. I had to listen to it on the radio last year. Because I totally stuffed up the dates with my trip, but I won't get fooled like that again. But this year I watched it from beginning to end. I didn't fall asleep. I did have some gin, but it didn't actually affect me too badly. So I watched the whole thing. So yeah, it was great. Really good event. There's plenty of news around today. I don't know if my Swedish viewers will be overly impressed with this article in the in news.com.au, which is part of the Murdoch Press, which does publish the Australian. It's a fairly critical article about how Sweden's had a bit of a flare-up with their COVID cases. So I'll go through it and give my comments as I always do. I'm not overly impressed with news.com.au necessarily. I think there's a lot of young leftist journalists in the Murdoch stable who are cutting their teeth in this particular segment of their empire. But this is an online site, and it gives some information about articles in the Murdoch Press which are not available if you go directly through the newspapers. Anyway, the Swedish approach to fighting COVID-19 takes a turn as cases spike. Coronavirus cases have doubled in Sweden in just 3 weeks as the wheels fall off the country's vaunted approach to tackling COVID-19. The wheels fall off. Rowan Smith wrote this, and I think Rowan's being a little over the top with that sort of terminology. Let's just wait and see what transpires before we come up with emotive type terms like wheels fall off. Coronavirus cases have exploded in Sweden. They've exploded again. You can see the way these things are written. They're very emotive. As authorities try to keep hold of twin battles containing the virus and controlling the narrative. Oh, okay, so it's a bit of a conspiracy thing, is it? The breakaway Nordic nation divided experts by refusing to lock down its citizens when the virus swept through the country earlier this year. But a devastating second wave has forced a dramatic rethink as infections threaten to derail any gains that were achieved by taking a now notoriously relaxed approach to the pandemic. Boy, this journo has put a lot of loaded words into this particular report. Notoriously relaxed approach, a devastating second round, very over-the-top prose in this that trying very desperately to dramatise it. It's not as big a deal as you might think if you look into the details. Regions have been effectively locked down to contain the doubling of COVID-19 cases in just 3 weeks. Okay, a doubling of COVID-19 cases in just 3 weeks. So what? How many deaths? How many people hospitalised? Those are the more important questions to be asked. Just because the actual number of cases has doubled from a very low base, because they have actually reduced the incidence of COVID-19 quite a bit in the whole country. Why is that such a big deal? I mean, it's an aberration. It's a change in statistically in the trend that had been occurring, but it's not the end of the world, for God's sake. David Steedsman, an Australian former public health researcher now living in Sweden, told news.com.au the region where he lives is experiencing a disturbing rate of new infections. This is the same David Steedsman who is basically dead against the approach that the Swedes have taken, which I think is a very sensible approach. He wants Armageddon. He says lockdown, lockdown, lockdown. I don't agree with him. I think he's crazy and he's not taking into account all the negative aspects of lockdown on a healthy population. Sweden has now seen a doubling in cases in 3 weeks, hitting more than 1,000 new cases in one day for the first time since June, he said. Hospitalisation and ICU numbers are always starting to increase. There you go, starting to increase, but then obviously not a large number of people, and that's the more important stat. He said Uppsala, north of Stockholm, where he and his family live, has seen more than double the total number of infections in the last 2 weeks, forcing authorities to introduce new restrictions. While most Swedes won't call it a lockdown, the key takeaway is, where possible, to avoid all contact with people outside your own family. Authorities are explicitly stating not to have social events and work from home if at all possible. Time magazine reports that Sweden's per capita death rate as of last week was 58.6 per 100,000 people, and that average daily cases rose by 173% from early September to early October, with particular dramatic increases in cities such as Stockholm and Uppsala. The Washington Post reports that Sweden's cumulative death total for infections is 10 times higher than neighbouring Norway and Finland, and 5 times higher than Denmark. Registered cases in Sweden are slightly above 106,300, compared with around 13,000 in Finland, 16,600 in Norway, each with about half the population of Sweden, the Post reports. And the UK Times reports that new cases each day have risen on average from 160 to almost 700 in October. Mr. Steedson, who used to work for the University of Queensland, says the Swedish government is looking at changing the law and, if necessary, the constitution to make requirements rather than expecting the population to do the right thing voluntarily. They expect it will take months to do so. It's anticipation of future crisis and won't be ready until next summer, he said. Sweden chief epidemiologist Anders Tegnell is reportedly travelling to regions impacted by COVID-19 to discuss their respective lockdown measures. He told the public broadcaster, if they don't seem to have an effect, then of course we need to consider other ways to constrain these opportunities for transmission. Dr. Tegnell, who has achieved a cult status in Sweden, has rarely swayed from his position. He told New Statesman in April that locking people up at home won't work in the long term. And I agree with that. I totally agree with that. Sooner or later, people are going to go out anyway, he said. And I want to make it clear, no, we did not lock down like many other countries, but we definitely had a virtual lockdown. He said Swedes changed their behaviour enormously and did so without laws needing to be enforced as they are in other countries, including Australia. We stopped travelling even more than our neighbouring countries. The airports had no flights anywhere. The trains were running at a few % of normal service, so there were enormous changes in society. But Mr. Steedson, who caught COVID-19 in March and is still suffering from a range of symptoms, including difficulty breathing, said the goal for Sweden was to achieve herd immunity, which, as a scientist, made no sense to him. Allowing a deadly virus to just spread in the hope of eventual herd immunity made no sense to me scientifically, given our limited knowledge. It's absolutely made no sense to me ethically, he told news.com.au earlier this year. People would die unnecessarily, and I was frankly disgusted with what I was hearing from Swedish Public Health Authority. Mr. Nick Talley, Editor-in-Chief of the Medical Journal of Australia, agreed that Sweden got it wrong. In my view, the Swedish model has not been a success, at least to date, he told news.com.au. One clear goal, at least early on, is to reach herd immunity, but this was not achieved, not even close, and this was arguably predictable. There were restrictions put in place, but the philosophy was voluntary rather than compulsory. Well, I'm sorry, I disagree. I think actually it worked pretty well, and just because there's been a bit of an upshot, with the cooler weather presumably being one of the causes, which is what happened in Melbourne, I'm still not sold on the fact that we have to basically restrict everybody to such a degree. The other consequences, suicide, lack of detection of things such as cancers and treatment for the same disease, the costs of having those curtailed is much greater overall than basically having a more laissez-faire attitude. And I would dispute the fact that there's no herd immunity has been achieved. I mean, who's to say that the Swedes aren't more immunised than other people because of what they've gone through? Let's see what happens in other countries before we come to those conclusions. I think this article was basically set up to basically tear down the Swedish approach, and I just because you actually interview a couple of people who are obviously dead against the current tactic in Sweden doesn't mean they've done the wrong thing. The one I'll do now is actually on Daniel Andrews again, and guess what? I warned Victorians that he would pull back on promised easing of lockdown restrictions. It's in his DNA to do this. So let's move on to the news and just see what the details are. Yeah, Daniel Andrews delays lifting lockdown restrictions as planned after a COVID cluster in North Melbourne leads to 7 new cases, but insists it is a cautious pause and not a setback. Oh, God. Who would believe this guy? Seriously. I mean, you've got to be kidding, Dan. Look, you just love toying with Victorians. You just love playing your sick mind games with them. Victoria is awaiting results of 1,000 tests from a northern metropolitan outbreak. Dan Andrews said it's a pause to rule out widespread community transmission. He said he anticipates that Melbourne will be able to reopen before November the 1st. Mr. Andrews acknowledged continuing lockdown is frustrating for Melbournians. It's just going to continue on because he'll find some excuse. I'm warning you, Victorians. This guy has to be thrown out. That's the best solution. Just get rid of him because he's bad news. Victorian Premier Daniel Andrews has refused to ease lockdown restrictions as planned following a cluster of 7 new cases in Melbourne's north. Mr. Andrews had previously promised to scrap the 4 reasons for leaving home and the 25-kilometre limit from November the 1st, provided the state had a rolling 2-week average of less than 5 cases a day. That's an absurdly low figure. And we're talking about cases, not people actually getting sick. Oh my God, this he's an absolute arsehole. I'm sorry. Despite the current average sitting at 4.6 new cases a day, the Premier said he could not open up until the results of at least 1,000 tests from the Northern Metropolitan outbreak were known. He described it as a cautious pause to rule out that there wasn't spread there. We already got that. This is not a setback. This is simply waiting and being led by the data. Oh, yeah, like you're a really top scientist, Daniel Andrews. There's no politics involved in what you're doing at all. There's no joy in basically locking up Victorians. You get off on it, mate. I mean, seriously. We have been careful and cautious, he told reporters. This is a pause, nothing more than that. We have hoped today to be able to announce that Metropolitan Melbourne would take significant steps, not from today, but from midweek around retail, hospitality, and a whole range of other important new steps. We're not in a position to do that today because we have at least 1,000 test results from the Northern Metropolitan outbreak that are in the labs. We are not, for the sake of being popular, going to ignore the fact that we ask people to be tested for good reason, for they have done that and we do not have the results yet. The Premier acknowledged continuing lockdown is frustrating for Melburnians. No, you're frustrating for Melburnians. Just piss off, Dan. That would lighten the burden for a lot of people. I know people are keen to have a long and detailed list of changes to the rules. It's not appropriate for us to do that now. I know it will be frustrating for people. We have all come so far, done so much. Oh my God, who's this guy, Churchill now? We have all achieved so much. Now is not the time to let our frustrations get the better of us. Oh, easy for him to say in his ivory tower. Bugger you. The all-important 2-week rolling case average is at 4.6 for Melbourne, below the trigger of 5 that Victorian authorities have coveted to trigger the next step out of lockdown. Former Health Minister Jenny Mikakis tweeted, "It's time for some safe easing of upper restrictions after hitting the benchmark." The regional average is at 0.2. I mean, that's absurdly low. It's virtually non-existent. How's this guy? How would he treat the normal flu? I mean, if we're talking about cases like this, this is madness. It'll just go on forever. You'll never get out of this trap that he's set up for you, Melburnians. Well, anyway, look, I'll leave it at that. You know how I feel about this. I've raved about it many times before, but this is just another indication that you cannot trust this man. And I've said it all along. He enjoys playing these stupid mind games. He really gets off on it. It's sick. Anyway, that's the end of the video. I won't go on any longer. 2 stories is more than enough. And so if please just give me thumbs up, thumbs down. Comments are always welcome. And please consider subscribing to the channel. So that's about it. I'll just go and bask in the old glory of the premiership for another few hours. And reality will strike me again on Monday. Probably won't have a video, by the way, so don't be surprised if I don't have time on Monday to actually post one. So it'll be Tuesday, I'd say. So have a good weekend, what's left of it, and stay safe, look after yourselves, and hope you get to see me on Tuesday.